Hi, I'm Dr. Mark Wheaton of Lakeside Sports and Pain Clinic in Excelsior, Minnesota, and here in Monaga, Minnesota. We specialize in natural treatments of chronic pain. So in the last episode, we talked about prolotherapy and what it is. Today we're going to be going a little further into why you should avoid anti-inflammatory drugs and cortisone injections. So cortisone is a substance that many of you have heard of, probably watching athletes in the news get cortisone shots in their knee or hip or shoulder to allow them to get back into the game. The problem is that what you don't know or don't see is that when that person gets back in the game, they're doing more damage to their joint even though the pain might be relieved. See, the reason cortisone is used at all is because it does give a pain relieving effect for a period of time. But in so doing, it damages the tissues such as the cartilage, the ligaments, the tendons inside the joints. So over a period of time, those structures begin to break down, compromising the joint and leading to deterioration, and down the road can lead to unnecessary surgeries and joint replacement. So cortisone, while it seems like a benign substance, really isn't. And so you ought to think very hard before you decide to get a cortisone shot in your joints for treating your chronic pain. Similarly, anti-inflammatory drugs such as ibuprofen or Aleve or Motrin, drugs like that, have the similar type of effect in that they block inflammation, which causes pain. But when you take those drugs, what you really are doing, you're discouraging the body from healing as it naturally should. And it's not like you're deficient in ibuprofen anyway. What you really need is to have the joints treated and repaired. And when the joints are treated and repaired, they become stable and the pain then goes away. So you're not masking the pain like you get with cortisone, but you get an actual healing effect that is long-term and does not damage the joints. So restoration of stability through the use of prolotherapy, stronger joints, better range of motion, better function are long-term benefits of having the prolotherapy treatment method used instead of resorting to the short-term damaging effects of anti-inflammatory drugs and cortisone. Patients will often come to me and say, well, I've got this disc problem in my back, or I have what appears to be some kind of a tear in my knee or my shoulder, and they might say, can I just get that repaired by surgery? Well, that's a good question to ask, because when you see something on an MRI, you think, well, that's not right, it's abnormal, so wouldn't it be easier just to fix it, like going in there and replacing a spark plug in your car, or fixing anything that needs repair? The problem with that philosophy is that the minute you enter a joint, you introduce the possibility of infection, and then when the surgeon's in there, he might be taking out more tissue than you really bargained for at the beginning. He may repair something, and of course the recovery period in the repair process can take a long time. The ultimate surgery, of course, is when a joint gets so damaged that it seems to be beyond repair and the person has a joint replacement. So the person is now receiving artificial parts that consists of some form of metal or titanium plus plastic, and those are foreign substances in your joint. Now, they may relieve pain for a period of time. In many cases, they don't even relieve pain at all, because the original source of the problem is, again, the ligaments that support the joint. So I would caution you not to just automatically assume, just because you see something on an MRI or a surgeon tells you that, oh yeah, I can just go into the joint and repair that. It's not as simple as that, and often leads to further deterioration, not to mention the scar tissue that it produces. So before you go in for surgery, make sure you get a consultation, come to Lakeside Sports and Pain Clinic to visit with me, and I will give you a very thorough examination and discuss whether you might be a candidate for prolotherapy and solve the problem using your body's natural method to try to heal the problem, because you can get a long-term healing effect and avoid that surgery you thought you needed and keep your original parts for as long as possible. So I would just conclude by saying avoid surgery and avoid cortisone shots and avoid anti-inflammatories at all costs. Not to say that surgery is never needed in some cases, but far too many surgeries are performed when the treatment could be as simple as getting prolotherapy and improve your function and reduce your pain for good. If you have any questions or want to know more about prolotherapy or whether you'd be a candidate for the treatment, please don't hesitate to call us at 952-593-0500 or go online at drmarkwheaton.com.